in today's segment of Wellness Wednesday, we're highlighting another side of breast cancer. According to the American Cancer Society, roughly 300,000 women are diagnosed every year. And that's why we have Alison Christopher with the North Mississippi Health Center to give some advice on what to do if you or someone you love receives a diagnosis. Thank you so much for being here, Miss Alison.
Thank you, Miss Tanya, for having me here today.
So now you work with the Cancer Care Center. Tell us a little bit about your role.
I am the breast cancer navigator with the Cancer Care here in Tupelo in MHS. And I work with patients from the beginning of diagnosis until they complete treatment. I am their point of contact, a support system, and I'm just keeping track of them through their whole treatment plan.
Now, when it comes to your role specifically, how critical is it to follow a patient from basically from the beginning to the end of their treatment plan?
It's very critical. For one, that patient can call me directly and I know where she is in that plan, and she doesn't have to go into a whole spiel every time. So that takes a lot off of the patient, just to have someone who knows where they are in their process and can help them at that moment with what's going on.
Yeah, that's very important too when you think about it. Having to repeat yourself multiple times, that can become quite frustrating, and especially with a person with a cancer diagnosis, you're basically trying to take all of this stress off of them that they're already going through. How important is it also for a breast cancer patient to have a support system?
The support system is so important with breast cancer diagnosis. There's such a high emotional impact on a patient with a breast cancer diagnosis, and that family and friend group really pushes them through and gets them through that whole journey.
Now, when it comes to being a support person, what is the best thing to do? What tips can you give us?
I think, going to doctor appointments is very helpful. Taking notes, keeping a calendar of all the different appointments, because they're going to have multiple appointments and it's going to get overwhelming to the patient. And so anything you can keep on track for them is helpful. Some patients are parents, and they may need help with child care and activities after school. Some patients may be caring for a parent. It just all what does this look like for that patient? And then emotional support, encouragement is so much with these patients. Just sending them a card, sitting and listening to them, celebrating whenever they pass a milestone is huge.
Wow. Well,
yeah.
Anything else you want to say, Miss Alison, before we let you go?
No, thank you so much for having me today.
All right. Well, thank you so much, dear Miss Alison Christopher, for sharing those tips with us.